Good afternoon, everybody. Hi, I'm Dr. Josh.
And I'm Dr. Kristina.
And welcome to Crossroads Chiropractic Facebook Live.
Yes.
And so today we are going to do something fun. Actually,
we have a demonstration.
A demonstration. And guess who's the dummy in the demonstration?
He is.
I'm the dummy. So most of you guys have been sitting around.
Yeah.
And because you've been not moving, unless you've been doing your exercises, we know you all have been, but we know there's a small percentage that haven't been. So
that's it.
This might be for you, this might not be for you.
Exactly.
I don't know. So we want to give you a simple at-home treatment, I guess, for lower back pain, which is a tip, which is fantastic. So most of you have been sitting around. You're probably getting active now that the weather's getting better. Yeah. You're probably doing some gardening. Yeah. You're probably bending over. Yeah. You're probably doing some raking. You're probably doing some shoveling. So your back is probably not. Yeah, your back's is not feeling great, right? And obviously it's because you haven't used these muscles for so long.
That's it.
Right? Unless you've been doing your exercises, which is
exactly. And we know that you have.
But we know you have.
It's just for the small percentage.
It's for the small percentage that have
it.
Yeah. So, I'm going to be the dummy. Dr. Kristina is going to explain what we're doing, and she's going to demonstrate it on you, okay?
Yeah, I'm going to demonstrate it on you.
Awesome.
So basically, the tip is taping for the low back, or for low back pain. Mm-hmm. So tape like this is called kinesiology tape. It's kind of a stretchy tape, and it's fabric-based.
But it has like a sticky on the back.
Yeah, and it's got a sticky and adhesive on the back, so you stick it to the skin. Yep. And you can get them pretty much at any pharmacy, as far as I know.
Yep.
Yeah. And so it's something easy that you can pick
and
up.
natural health food stores too.
Right.
I bought one I was having some knee problems. I did some kinesio for my knee, and I got it at Nature's Emporium.
Perfect.
In town. So
there you go. Yeah, so it's pretty accessible, I think. Not anything you have to, go to a specialty store for, really. And so to do this, you're going to need 3 pieces, and you're going to have to measure basically, so I'll have you actually turn around already. So we're going to have you measure from the belt up, okay, to kind of mid-back, all right? So you probably want, 6, 8, maybe 10 inches long. So you're going to need 3 that size, because the third one is going to go across, and you kind of want it to be able to go hip to hip, okay? And so what you do... So
you're going to get some skin.
That's it. All right, so we're going to stick it
And I didn't do my abs this morning, so if I don't look buff, that's why.
You're fine. So it's really quite sticky. So we're going to start down here. So let's say you've got an injury kind of down in this area, okay? Or you feel really tight and stiff and sore. So we're going to start down here at the belt. Sorry, I'm going to move your underwear.
Good. No shame.
All right. And then as you go up, you're actually going to want to pull it a little bit, okay? So you're probably going to get fairly high into the mid-back, okay? So you're going to put on one side of the spine, all right? Then the next piece is going to go on the other side of the spine. So just, if you need to kind of palpate or feel around to feel the bony bits in the middle there. So you don't want to be covering those. You want to be going parallel to the spine on both sides, okay? So let me get the other one ready. And now when you cut each strip, it would be good to round the edges, okay? So it helps keep it from fraying, and it keeps it in place better, all right? So we're going to go on the other side. So you're going to start again at the belt, and then you're going to pull it a little bit, and you're going to see how stretchy it is up to the mid-back again on the other side, okay? And have the person bend over. So you might need a significant other to put this tape on you, because you kind of need to stretch the skin a little bit as well.
That's why I'm bent over.
That's why he's bent over, just so you know. So now this other piece here is going to go perpendicular across at the site where it's most sore or most tender, because that's where you want the support, okay? So let's say for Dr. Josh, it'll be around about there. So that's about L3, L4, or L3, L2. And you're going to start on one side. Let's get this out. So you're going to start on one side about the hip, okay, just above the hip, and then you're going to pull it across as you go. Okay, and take off the piece of the back. It maybe take a little bit of a technique, but you can kind of peel these up again, maybe once or twice. so they don't lose too much adhesive. And that's it.
That's it.
That's it.
Awesome.
Awesome.
Yeah, so it gives it a little extra support. So it really is extremely effective. Again, like I said, I used it for my knee. I was having some knee issues. I'd strained the knee, and I was doing the Ironman races at the time, so I needed extra support. I didn't want to finish my thing. So it does give you support to continue with it. Now, one thing is if you are really, really injured, you need to modify your behavior. Of course. You don't want to go back and keep doing what you're doing and use this as a crutch to continue to injure yourself. That's not what the purpose is. The purpose is to take some of the tension off so that you can, to relieve some of the issues so you can get on with life, really.
That's it. And I mean, if it's very serious and you have a lot of pain, you're more disabled, you're having trouble moving around, at that point it might be...
You need to be here.
Yeah. You need to see a chiropractor
you need to get adjusted. Exactly.
For an
emergency adjustment. Absolutely.
Case, right? So
Absolutely.
Keep that in mind. But this is kind of just a temporary thing for something more mild.
Yep.
Yeah, definitely.
And it really works. Now, the one thing is I did have one patient who was allergic to the glue.
Right.
That does happen in some people. So it's hard to tell who's allergic and who's not. The only way you're going to know is if you put it on. And if you start getting really itchy, you get red, you start getting some swelling, take it off right away.
Maybe try, if you're not sure, cut a little piece and try it on your skin beforehand. Just leave it on for half a day.
If you're concerned or if you're worried that you might be. Because if you've had reaction to other glues, bandages, things like that, there's a good chance you might be. So do the test, see if it works. And if it doesn't, then awesome. Then go for it.
Yeah.
You should be good.
That's it.
Awesome.
So it's relatively easy, simple to do.
Yep.
And
it feels good.
Quite effective. Yeah.
Yeah, it really does feel good.
So you've got that support there now.
Yeah. I love it.
I'm
well supported.
Well supported. Fabulous.
Awesome.
All right.
So if you like this video, please share it.
Yes.
Share it with all your friends and family members. If you have any questions about our specific areas, we did the lower back, but if you have questions about
we can do other
parts,
areas too.
You can do pretty much shoulders, knees, you name it, you can do it.
Yeah.
And there's different brands too if you have any questions about the brands, because there's named brands, which we're not going to talk about, but you can ask us specifically about that. We can help you with that.
Yeah.
Check us out on Facebook, on YouTube, on Instagram, right?
Yeah.
And be sure to check out our website, right? www.crosschiro.ca, which is awesome. And because we'd love to hear from you. So,
absolutely.
If you're seeing a chiropractor,
fantastic.
Keep getting them checked. If you're not, we'd love to see you. Check us out, Newmarket Chiropractor.
Yeah.
Yeah, awesome.
Thanks so much, guys.
Thank you very much. We will talk to you guys later. Have a fantastic long weekend. Get out there gardening.
Yes.
Make sure you warm up. Do your exercises. Do the taping if you need to.
That's it.
And we'll see you next week.
You're all set.
Awesome.
Bye.
Bye.